Your aorta is under constant pressure right now. It's the width of a garden hose, carrying your entire blood supply, non-stop. Now picture the inner lining of that hose tearing wide open, blood flooding straight into the wall itself, forcing the layers apart, like water peeling wallpaper off a ceiling. This is aortic dissection, and it kills faster than almost any cardiovascular event. Most people who survive it had no idea they were ever at risk. Let's look at what's actually happening inside your chest. Your aorta has 3 layers, wrapped one inside the other, like a garden hose sheathed in 2 more hoses. The inner layer, called the intima, takes the direct hit from every single heartbeat, year after year. High blood pressure hammers that wall over time. Tiny cracks form, invisible, silent, waiting for the wrong kind of strain. One day, that crack splits wide open. Blood punches through the tear and rushes into the middle layer. It carves a brand new channel, a false path, tunneling right through the wall of the vessel itself. That false channel can race up through the ascending aorta or down the descending aorta toward your abdomen in seconds. If it reaches the aortic root, right where the aorta meets the heart, the pressure can become life-threatening. Survival drops with every passing hour. So who's actually vulnerable? High blood pressure is the #1 driver. Not occasional spikes, but years of grinding pressure. It wears down the vessel wall slowly, like water eroding a canyon over decades of unmanaged strain. If your blood pressure sits above 140/90, untreated, you're weakening this structure every single day. Genetics load the gun. Marfan syndrome and Ehlers-Danlos syndrome weaken your connective tissue from the day you're born. Unusually tall, unusually flexible, or a relative who died young from a heart problem, that history matters more than you think. A bicuspid aortic valve raises risk too. Normally, your valve has 3 flaps working together in perfect rhythm. About 1 in 50 people are born with only 2, adding turbulent stress that thins the wall over time. Most dissections strike men between 50 and 65. But pregnant women face a unique risk window in the 3rd trimester. That's when blood volume surges and hormonal changes soften the vessel walls from the inside out. Cocaine or meth use spikes blood pressure instantly, often finishing what years of quiet damage already started. A tearing sensation, often called the worst pain of a person's life, moving from the chest into the back. Some people notice a pulse difference between their 2 arms, or sudden weakness on one side of the body. Every hour without treatment raises the death rate sharply. This is not a symptom to sleep on or wait out. Get your blood pressure checked, and treat it aggressively. And ask your doctor about family history of sudden cardiac deaths before 60. If Marfan or Ehlers-Danlos runs in your family, request an aortic imaging scan before symptoms ever appear. And if you lift heavy weights, learn proper breathing technique instead of holding your breath under load. Your aorta doesn't warn you for years. It stays silent until the moment it's not. And the people who survive already knew their numbers.